My name is Kylie Patterson. I'm a Student Industry Liaison Officer and Trainer and Assessor here at AVT. I'm also a qualified and registered veterinary nurse.
Hi, my name is Jo. I am the Practice Manager here at Vet West at Currumbine.
Hi, I'm Jamie. I'm currently the Student Liaison Officer for AVT. I've been a veterinary nurse for 10 years and love the job.
So our students are considered on work placement, which is very different to work experience. The difference being is that the students are fully committed to their studies and have a passion and want to be in your work practice. They're not just there on work experience deciding whether if this is the industry they want to be in. They already know that they want to be here.
The main benefits to having a student within the veterinary clinic, there is many, and there's a lot that helps the clinic. A good example, what I found was they actually provide a very good support for the nursing team in small ways to start off with, so they can help obviously with the small jobs that nurses try to get done. So for example, laundry, just the general cleaning up, and then they move up and they can be an even bigger help within surgeries. And they end up being an essential part of the team.
There's big benefits to the whole team about having students here because we are a very busy clinic, and it's always great to have an extra pair of hands on board, and eventually once the students have been here for long enough, they're like having another person in the building, another staff member once they've learnt lots of things, and so it just makes our day a little bit more efficient. It means that we get out on time, and yeah, they're just helping us in a big way. The benefit of having a student in the practice is it also gets my staff to actually teach people, so it reinforces their skills that they have as well. So they could be teaching someone how to put in a catheter or collect blood or wrap kits, and it just reinforces what they know, but it also gives them skills to going on and furthering their career as a head nurse or something, because you have to be able to talk to people and teach people.
So here at AVT, we expect our students to be provided with a safe working environment. We also expect our workplaces to be able to give the students a hands-on opportunity to be able to participate in practical tasks. So things such as placing IV catheters, assisting in monitoring surgery and anaesthetic once they've been in practice for quite some time and you have built that trust in with the student, through to being out on reception, talking to clients, discharging patients, etc. Those are the tasks and things that our students are required to do whilst in the workplace, and we do expect our workplaces to support our students in that regard.
One of the other major differences between AVT and other RTOs for veterinary nursing is that we have a very select process in recruiting our nurses. We want our future nurses to be the best that they can be. So we start at the very start, which is the recruitment. We have an interview process which allows us to see how the individual nurse may fit in with the clinical setting and group and within a team. And we pick out who will be able to be resilient enough to withstand being in a clinic, which is really important, especially these days with the amount of pressure that the clinics are under. So I feel like we start from the very beginning of the process to make sure that we select the nurses for the future for everyone to benefit from.
So at Vet West we choose to have AVT, they do online as well as obviously in the classroom, but it doesn't matter, all the content that they're given is of such a high standard, so when they do actually come into Vet West they've already got a really sound, high quality background knowledge, and also it helps with the support staff. If I need to speak to anybody, they're only just a phone call away to be able to support me and any of the students.
I often get asked, can I employ my AVT prac student? And the answer is yes. So any agreement that you do have with your student in terms of employment, etc., is between you and the student, and you are able to offer and have the student as an employee in your workplace.
So one of the most rewarding things about having students for me is seeing them grow, seeing them learn more, seeing them get excited about seeing different procedures that are happening. But personally for me, it's when I see how good a student is doing and I know that I've got a position coming available, going and saying to them, would you like a job? The look on their face is just fantastic because it's everything to them, and I am really happy to be able to offer that to them.
If you're interested in having an AVT student, the process is very simple. You call AVT and speak to one of our student liaison officers, and we will have a quick discussion with you to find out what qualities you are after in having a student. We will then find a student for you that suits your clinic needs.